If you are someone who takes care of human beings in a healthcare environment, I need you to listen the hell up. I just watched another video of a Black woman being dismissed in active labor and having a baby 8 minutes later. It is disgusting to watch, but finally, people are paying attention. This is an article that was written 2.5 years ago. I talked about how if you are a nurse who says shit like, I'm colorblind, I don't see color, I treat all my patients equally, that you are part of the problem. You are actively contributing to harm because your passive silence is active violence. So you might not be the nurse that does the side eye to a laboring Black woman, but you won't be the person to speak up when something is wrong. You'll be the nurse just following doctor's orders, just pushing the patient to the car. But if you are the kind of nurse who cannot recognize that a patient's skin color, one of the most obvious things about them, puts them at a 3 times greater risk of death, what are we doing? I'm going to explain to you why equality should never be a goal in healthcare. Our goal should be equity. I'm going to use a photo that's often used to explain this, but I'm going to explain why it doesn't work on our scenario and give you a better example. So this is what equity means, okay? We're not giving everyone the exact same thing because giving everyone the exact same thing will still end with people having bad outcomes. We have to recognize the specific needs of our patient and give them exactly what they need to be successful or to live or to not be traumatized when they come into a hospital. Here's why this doesn't work when we're talking about Black women. This puts the problem or the onus within the body of that person.
Now that I have you all here, after subjecting myself to public scrutiny and I have your attention, I want to talk to you about the Black woman that was robbed of her dignity, respect, and compassion by a racist, soon-to-be former nurse. And if you look like me in any capacity, it is your obligation to know and understand what systemic racism is, racial disparities that do exist, such as Black women dying at 3 times the rate of white women and including their babies. It's not enough to just be not racist. You need to be anti-racist. You need to be outspoken. You have the obligation to be outspoken and anti-racist because it is not a Black person's job to explain their everyday lived experiences to you in which you will continually reject and deny. It is no longer you didn't know. It is no longer willful ignorance. It is racism. And I don't care if you like it or not. You cannot just treat your patients the same. That is racism. Treating your patients the same means Black people die. They need to not only be cared for, but they need to leave feeling like they were respected and safe. And that's not happening. And people need to keep recording these incidents and posting them online. If that Black mother was robbed of her dignity and respect and compassion, that racist nurse deserves none of it. And when in doubt, shut your mouth and listen to Black women. Period.
I cannot believe what I'm reading, and I refuse to let this one go under the rug. So this is a nurse in Virginia. She's 26 years old. Her name is Erin Stratman. Now, she was just charged with malicious wounding and felony child abuse. She was intentionally breaking the bones of Black newborns in the NICU. Now, these babies were already fragile. They're fighting for their lives in intensive care, and the mothers trusted staff to take care of their newborn children. And she betrayed that trust in the most horrific way imaginable. So back in November, doctors discovered that 3 newborns had just unexplainable fractures. And this is not even her first time doing this, because back in 2023, 4 babies in the same NICU had unexplained fractures as well. So there's 7 Black babies with unexplained broken bones in the same NICU. And one baby in particular, this is Noah. Noah was born premature. So then the parents noticed that not only was his leg discolored, but then he just stopped moving his leg altogether. And when Noah got an x-ray, they showed that he had a fracture. And can you imagine, the parents were so afraid to hold their own baby because they didn't want to be accused of child abuse. And one mother even lost her baby. And I just have so many questions. Why wasn't this caught sooner? Did you purposely get a job at a NICU? And how did this go on for over a year? And why aren't you getting charged with a hate crime? You targeted 7 black babies, some of the most vulnerable lives in our community. And to make it clear, she was denied bond, but that's not enough. The family needs answers. The families deserve justice, and we're not finna just let this.
Wow. We're looking at the ills of what is happening in the medical sector as regards to black women and maternity and post-maternity, care that are given to mothers, nursing mothers in America, especially the black ladies in hospitals. And these nurses are telling us the things that are panning out, that are playing out behind the back door. Some of these stories are very uncomfortable and unsettling to know that people that are melanated are treated in a very different way. If you're coming across my YouTube channel, you're welcome. We'll be considering one more two videos, then we'll come back to give our analysis. If you're first time, please hit the subscription button, hit the notification button. If you're an old timer, thank you for joining in the conversation. All credit belongs to the original content creator. So we'll dive in right into the video and come back to give our final opinion and analysis.
I do presentations for nurses and talk about the importance of speaking up when it might feel scary to protect our patients from birth trauma, harm, or death. And in this presentation, I made this graphic, which shows 2 equally heighted women in 2 different environments in the same place. This woman's ancestors were enslaved women who were experimented on by a monster named James Marion Sims and called it gynecology, given procedures without anesthesia because they thought black women could not feel pain. Even in my nursing books, in the culture section, it talked about how black women have a higher pain tolerance. In order to improve outcomes for this patient, we have to either repair the ground underneath her or move her to a safer location. We have to change her environment. And when it comes to birth, there's a lot of well-meaning advocates who say, this is why you should have a home birth. No, that should never have to be the answer. We have to make birthing in a hospital while black safer. And it starts by treating your black patients differently. Stop being personally offended if they don't inherently trust you because you're wearing a badge and scrubs, because they've likely experienced mistreatment from someone who looks an awful lot like you. It's why my 9-year-old doesn't fuck with bees. He got stung by a bee, and even though there are going to be millions of bees who don't sting him, he will never trust a bee. And I don't blame him, because every bee has the opportunity to hurt him. We know that black women are less likely to be listened to, so knowing that, how would you approach a patient who you knew was at a higher risk of not being listened to? Would you pull up a stool and hang on every word she says? Would you make a promise to listen to her? Would you echo her wants and desires louder to the other people on the care team? Would you act immediately if she says something is wrong? Or would you brush it off and say you're fine? But most importantly, are you willing to speak up against your coworkers, against people you may consider to be your friends, when something is not right? If even half of the healthcare workers in this country made a pact to never allow this type of behavior to exist in our orbit, we could make things better. But it counts on you holding up your end of the deal, to treat your black patients differently, to never be silent in the face of injustice, and to always be on the lookout for ways that you can help your patients feel heard. I'm well aware that what I'm about to say could get me in a lot of trouble, but I think it's important enough to say. I'm a labor and delivery nurse, and I treat my black patients differently. I've seen nurses, especially labor and delivery nurses, online saying things like, I'm colorblind, I don't treat my patients any differently, meaning that they don't treat their black patients worse than they treat their white patients. And here's why it's not enough to be a colorblind nurse in 2023. Because I know that in my specialty, labor and delivery, black women are more likely than any other race to be harmed in pregnancy, childbirth, and beyond. The US is the worst place to have a baby if you're black in the developed world. Why is this not happening anywhere else? Systemic racism. If you don't believe me, just Google James Marion Sims. So not only are black women not believed about their pain, not believed about their symptoms, but also they may put off getting something checked out because they don't trust medical providers for good reason. So here's how I treat my black patients differently. Number one, I don't expect them to inherently trust me because I'm wearing scrubs and a badge. And I don't get offended if they don't. Many Black women are coming in to have a baby already having experiences of not being listened to. And until I'm able to prove to them that I'm someone that can be trusted, they shouldn't trust me. More than my white patients, I emphasize the fact that I will always believe them. Yes, my white patients know also that I will believe them, but I really, really drive it home that I promise you that I'm going to believe everything they say. I include every single person in the room who is supporting this patient in a conversation about preeclampsia, even if they don't have it. Because preeclampsia is one of the leading causes of maternal mortality in the United States. And preeclampsia can happen even after you've had your baby. I tell them about the symptoms, and I also tell the support people that if you hear her saying any of these things, make sure that she gets seen. And if when she gets seen, you don't feel like she's being listened to, go somewhere else. I let them know that I'm here to be their birth bouncer, and that I'm not going to let anyone do anything to them, only for them and their baby with their permission. I can neither confirm nor deny whether I have slapped a provider's hand away when the patient said no. I don't know anything about that. I have no hard data to back this up, but I have a hypothesis that Black women are not being repositioned in labor as much as white women. So my patients know, and I will say this, that I'm going to turn you like a rotisserie chicken, because movement is gold in labor, especially after you have an epidural. If when we have a baby, I don't like the amount of bleeding that I'm seeing, I am early talking to that provider about, hey, what do you think about maybe giving a little bit of Cytotec? What do you think about putting in a Jada? Because postpartum hemorrhage is the leading cause of maternal death. I will always use whatever privilege I have to make sure that my patients are heard. That's why it's so important to treat your Black patients differently. And if you're a colorblind nurse, you're part of the problem.
Welcome back, guys. This is very strange and this is scary, and this was like one of the initial videos I did initially, why Black community, Black people, Black folks were saying, we are calling out why we need Black doctors to handle Black people, and some people felt it was quite racial, but it's clearing that it's a systematic structure that has been put on ground to undermine the healthcare and the life of mothers who are putting birth, Black mothers post and prenatal, both ways. And so I want to know what your thoughts are, your opinions are, because the truths that are exposed by these nurses are quite alarming and concerning. So let's conversation begin in the comment section. See you on my next video.